Hello everyone, drberkkkaratas. Sometimes you might have issues with erection. You go to the doctor and the doctor says, your problem is psychological, my friend. He tells you to go see a sex therapist. I will give you a physiological treatment. He might say that I don't need to do anything. These situations are what we call physiological erectile dysfunction. We call it non-countable, erectile dysfunction. I also provided this under that title in the book. Now, of course, the issue here is that it needs to be treated. So, what I'm going to talk about shortly, the issues also need to be treated, but physiologically that's it. Shock, it's a constriction, it's PVF, it's medication. We don't need these, we shouldn't be doing these things. I always say this, erection equals hardness. Now, we can't control our organs. In other words, we don't have control over our organs. For example, you can't say this to your bladder. So today, urinate less. I'm going to hit the road, so you do less. Tomorrow, I won't be on the road. I'll return to my normal life. You can't say that you'll do it very well then. The penis is like that. We had a video called I Can't Control My Penis. If you watch that part, you can understand it more clearly. Why does every organ work on a cause and effect basis? Every organ, the penis also works with pleasure. If you experience pleasure, you'll have hardness. If you replace pleasure with worry, anxiety, or anything else, you won't achieve an erection. So what is included in the definition of erectile dysfunction? The lack of hardness is a consistent and recurring inadequacy for sexual satisfaction. Look, this is very, very important. Consistent and recurring. So it's important for us that the hardness is the same degree under every condition and with every person. If there is no such situation, there is no need for physiological treatment. The main idea of the matter is this. Let's see, the first one says, teacher, I have no problem in the first relationship. In the second relationship, there is a problem. They usually come in saying that they have erectile dysfunction. I will talk about this a bit later. There's a much deeper reason behind it. They say there is a problem in the second and third relationships. Okay, they have the first relationship. The hardness is perfect. In the second relationship, there is an erection problem. If you have such a question here, this is what you need to ask yourself. The question is this. Why do I want a very good relationship? So I want more than one. Okay, you might have a lot of desires. Your desires might be too much, but is there compatibility with your partner? So does your partner want it? Is the environment suitable? Is the timing right? Do you have any fantasies? Aren't you? You need to question things like that. The second one is early. Ejaculation is one of the most important issues. Patients who experience early ejaculation at first, this may change later, but generally at first, they want a second or third relationship. Why? Because they themselves haven't experienced enough pleasure a short time. They haven't been able to satisfy their partner either. They say, let me go from 2, 3 to 4 or 5 right away. But of course, this is not something sustainable. After a while, especially if you keep doing the same act with the same person, it will become very difficult after a while, 2, 3 times. This is also a condition that needs to be treated. If you pay attention, it's not erectile dysfunction, early ejaculation, or partner sleeping. Another situation we encounter very often, there's no hardness issue during masturbation, but there is a hardness issue during intercourse. If there is such a situation, of course, you need to question the relationship at that moment. For example, if you're having intercourse for the first time in your life, this can happen from anxiety, worry, excitement, etc. It can happen. Or the right time or place may not involve the partner. That can happen too. But the most important question you should ask, the question is, how do I masturbate? Because if you masturbate, if it's not suitable for intercourse, this is referred to as traumatic masturbation. In the context of the relationship, this is referred to as traumatic masturbation syndrome. If you don't masturbate in a way that's suitable for intercourse, then in the relationship, this is a problem that arises from the scientific study we conducted, indicating a 60% rate. You may encounter erectile issues at a rate of 60%. Of course, this situation requires behavioral treatment. Look, there's no need for physiological treatment here. A behavioral treatment. Masturbation should be adjusted and done in a way that's suitable for intercourse, and then the person should continue with their sexual life. Another situation is the difference between partners. So sometimes it happens that you have a spouse, but you also go outside. Everything is fine with my spouse, but things aren't working out outside, or it could be the other way around. When such a situation arises, it's really important to question your partner. For example, if things aren't working out with your spouse, there may be some issues with them. You can question these in terms of sexual or social aspects. Value judgments are very important here, especially in our country. Beliefs are very important because in some way you are married or you have been with someone else. I committed adultery there, the perception of it, and so on, the perception of sin. These are all things that cause issues with erectile dysfunction. What did I say? Instead of pleasure, if you put something completely different, then it means you won't have an erection at all. Another situation is the loss of firmness right at the vaginal opening. So everything is normal. The person's relationship with masturbation and everything else is normal. It's almost there. It's coming, it's coming. Just when it's about to enter the vagina, there's a loss of erection. This is also a serious issue. I won't go into too much detail. We had a video related to this with Shahin Bey. I had also made a video myself. You can watch them, but so the issue is only at the vaginal opening. If there's a loss of firmness, then there must be a reason for it. This needs to be addressed with a sexual therapist. This is also difficult to resolve with physiological conditions, meaning it requires physiological treatment or something else. There's also a sudden onset of erectile dysfunction. What is that? So last night everything was fine. You started work today, but it's not happening. The partner hasn't changed, the environment hasn't changed, but it's just not happening. So in this case, if there is no accident, no surgery or any other problem, of course, if there was a surgery, for example, if you had back surgery and it was problematic, and after the surgery you experienced issues with firmness, or if you had an accident, these could be related to trauma. I'm not talking about those. Here the topic is that nothing happened, your life continues normally. We had a situation like this with a married couple one night. We had a newlywed couple. The guy had his bachelor party 2 days ago and it was top notch. As soon as they get married, erectile dysfunction occurs. So there was something that came up there. In sexual therapy, when I was around 13, 14 years old, his sister hit him while washing. At that moment, he said, this is a very tiny little thing. This is useless. He said it wouldn't work at all, especially after getting married. Something like this happened. He was hypnotized. So this has been resolved. Has it been resolved? It's being resolved. But don't forget this. Of course, there's no guarantee that it will be like this for you, but I gave an example. In cases of sudden erectile dysfunction, it's essential to investigate the underlying psychological cause. Because, as I said, an organ doesn't just suddenly malfunction if there's no trauma. I mean, your kidneys don't just fail overnight. If you do not have any problems or have such problems, you do not need physiological treatment. I don't think you need to see a urologist either, a sexual therapist. You can talk about it, or if you have a problem related to traumatic masturbation, for example, you can receive behavioral therapy for that, and so on. Most of the situations here can actually be noticed and resolved by yourself without going to any doctor. What's important is that you are aware. Thank you.